And remind me, so you have training in psychiatry as well, right?
Yeah, so I've MD, PhD, and did residency in psychiatry.
Mhm. So as someone with that sort of dual background in functional imaging, human systems neuroscience, and psychiatry, when you think about taking this stuff from the laboratory to the clinic, when you think about the nature, the inherently subjective and powerfully subjective nature of these drugs, and you think about things like the procedural requirement to have placebo control groups when you're trying to do clinical trials to get things approved by the FDA. What do you think about? So maybe we'll just take the MAPS studies that the FDA didn't approve recently. I believe one of the key things there for the FDA was that you didn't have what they considered to be a true placebo control group. Given the nature of these things with when it comes to subjectivity and the subjective effects and your psychiatric background, how do you sort of think about doing placebo control studies, or whether we need to rethink that perhaps when it comes to thinking about whether to take these things to the clinic and start using them on a larger scale?
Yeah, that's been a big issue. And I can't even decide how to respond because I totally appreciate both sides of the argument. So let me like build both sides very quickly of the
Mm-hmm.
argument, and then we can pick which side we like. So on the one side, and I really like depends what day you ask me, I believe both things. On the one side, it's like a ridiculous idea that I should be able to control for this powerful transformational experience. Because what does that even mean? Like it is fundamentally the combination of expecting that you're going to have a powerful transformational experience, plus having a very salient, very powerful experience uh, that enables healing and enables somebody to, I think both of those are like important parts of recovering from a psychedelic treatment or with a psychedelic treatment. Um, and and to label like the to label that a placebo effect, it's almost like, well, okay, fine if you want to, but it works, right?
Mm-hmm.
So who cares if you label it a placebo effect?
Yeah, and I think
Does that make sense?
one thing that's worth pointing out here, at least for me, is what we might call an orthodox sort of clinical view would be that, well, there if we're talking about the brain and say curing someone's depression or something like that is going to involve triggering a certain pattern of brain activity that makes them better. I'm just going to call the orthodox clinical view might be something like, well, we need to have a placebo control group to show that it's not merely or largely someone's expectation or desire to get better that is actually
Yes.
making them better. But what's problematic about that is the effect of the drug coupled with things like your desires and your expectations will actually induce a different pattern of brain activity, which so someone with who wants to get better and expects to from the drug is going to have that expectation coupled to the drug effect. That's going to induce one pattern of activity. And if I'm highly skeptical, or I'm just rigid, and I don't necessarily have the motivation to get better that the other person does, that's going to mix together with the drug effect and give a different overall pattern of brain activity, which itself, I mean, if we're talking about patterns of brain activity, that is sort of the medicine here in some